Title: Diabetes Alert. Warning signs you can't afford to ignore. Introduction. Diabetes is a chronic metabolic condition that affects how the body converts food into energy. With over 500 million people currently living with diabetes worldwide, this silent and potentially deadly disease is a growing global concern. While manageable, undiagnosed or poorly controlled diabetes can lead to severe complications such as blindness, kidney failure, heart attacks, and even death. One of the most alarming aspects of diabetes is how subtle its warning signs can be. This comprehensive guide dives deep into the early and late warning signs of diabetes, its complete history, types, causes, risk factors, complications, and preventive strategies. The history of diabetes. Ancient records. The first documented mention of diabetes dates back to 1552 BCE, when Egyptian physician Hezi described a disease that caused frequent urination. Ancient Indian physicians later referred to it as madhumeha, meaning honey urine, due to the sweet smell and taste of the urine. Greek and Roman discoveries. The term diabetes was coined by the Greek physician Aretius in the 1st century CE, meaning to siphon, describing the excessive urination. Later in the 2nd century, Galen added to the knowledge but wrongly assumed it was a kidney disease. Modern understanding. In the 19th century, scientists discovered the link between the pancreas and diabetes. In 1921, Canadian scientists Frederick Banting and Charles Best discovered insulin, revolutionizing diabetes treatment. What is diabetes? Definition. Diabetes is a condition characterized by high levels of glucose, sugar, in the blood due to the body's inability to produce or effectively use insulin. Types of diabetes. Type 1 diabetes. Autoimmune condition where the immune system attacks insulin-producing cells. Type 2 diabetes. The body becomes resistant to insulin or doesn't produce enough. Gestational diabetes. Occurs during pregnancy and usually disappears after delivery. Prediabetes. Elevated blood sugar levels, but not high enough to be classified as type 2. Causes and risk factors. Type 1 diabetes causes. Genetic predisposition. Autoimmune response. Environmental triggers, e.g. viruses. Type 2 diabetes causes. Obesity. Physical inactivity. Poor diet. Genetics. Age, over 45. Gestational diabetes causes. Hormonal changes. Obesity during pregnancy. Family history of diabetes. Risk factors. Family history. Ethnicity. Higher risk in South Asians, Africans, and Hispanics. Polycystic ovary syndrome, PCOS. High blood pressure and cholesterol. Early warning signs. Frequent urination. Excess glucose causes the kidneys to work overtime, leading to increased urination. Excessive thirst. Dehydration from urination results in persistent thirst. Unexplained weight loss. In type 1 diabetes, the body burns muscle and fat for energy due to lack of insulin. Extreme fatigue. Lack of glucose in cells leads to constant tiredness. Blurred vision. High sugar levels pull fluid from eye lenses, affecting vision. Slow healing sores. Poor circulation and high blood sugar impair healing. Increased hunger. Fluctuating sugar levels lead to recurring hunger. Late-stage and severe warning signs. Numbness and tingling. Indicates nerve damage, common in prolonged diabetes. Persistent infections. Yeast and urinary tract infections occur more frequently. Dark skin patches. Known as acanthosis nigricans. Found in body folds. Vision loss. Diabetic retinopathy from damaged blood vessels in the eyes. Kidney problems. Elevated sugar affects filtering units in kidneys. Complications of diabetes. Cardiovascular disease. Increases the risk of heart attack, stroke, and hypertension. Neuropathy. Damages peripheral nerves, leading to pain, numbness, and digestive issues. Nephropathy. Progressive kidney damage that may lead to dialysis. Retinopathy. Can lead to blindness without proper management. Diabetic foot. Infections and ulcers that may require amputation. Diagnosis and monitoring. Diagnostic test. Fasting blood sugar. Oral glucose tolerance test OGTT. Hemoglobin A1C. Continuous monitoring. Blood glucose monitors. Continuous glucose monitors, CGMs. Prevention and management. Lifestyle changes. Healthy diet, low sugar, low GI foods. Regular exercise. Weight management. Medication and insulin. Oral antidiabetics. Metformin, sulfonylureas. Injectable insulin for type 1 and advanced type 2. Stress management. Yoga, meditation, and sleep hygiene reduce hormonal triggers. Regular checkups. Early detection through routine blood work. Living with diabetes. Emotional support. Counseling and support groups are vital for mental health. Diet planning. Focus on balanced meals, portion control, and timing. Emergency readiness. Carry glucose tablets or snacks for hypoglycemia. Educating loved ones. Helps them understand and assist during emergencies. The future of diabetes. Advances in technology. Smart insulin pumps. Artificial pancreas. Improved CGMs. Research and cure prospects. Gene therapy. Beta cell regeneration. Vaccine developments for type 1. Conclusion. Ignoring the early warning signs of diabetes can have dire consequences. From frequent urination to fatigue, these symptoms are not just trivial, they're your body's way of signaling a deeper problem. Recognizing them early, making lifestyle changes, and seeking timely medical help can prevent long-term complications and improve quality of life. As awareness grows and technology advances, the battle against diabetes continues, but the first step begins with recognizing what your body is trying to tell you.